Hi everyone, this is Catherine Miller, and my paper was Murine Models of Cardiovascular Comorbidity in Chronic Obstructive Pulmonary Disease. It was written by Pedmini et al., and it was published in the Journal of American Physiological Society and published in March of 2016. It's a review paper on mouse models and clinical models of both cardiovascular disease and chronic obstructive pulmonary disease, and how cardiovascular disease is commonly seen in patients who have already been diagnosed with chronic obstructive pulmonary disease. Hence the comorbidity, which means the presence of two chronic diseases or conditions present in a singular patient. So, some background. Chronic obstructive pulmonary disease, or COPD, is a lung disease characterized by the progressive and irreversible limitation to airflow due to chronic inflammation and destruction of lung tissue. COPD develops due to repeated exposure to noxious substances such as cigarette smoke and other similar risk factors, such as bacteria and other environmental pollutants. Common symptoms are coughing, shortness of breath, and a thick mucus produced by the airways. COPD used to be classified as chronic bronchitis or emphysema due to those being the common symptoms. However, COPD is able to be diagnosed after prolonged presence of these symptoms and a significant deterioration of the lung tissue. Cardiovascular disease is a class of diseases that involve the heart or blood vessels, including but not limited to coronary artery diseases. Thrombosis that includes heart attacks and stroke, and many cardiovascular diseases include arteriosclerosis, which is a thickening of the artery wall due to an accumulation of white blood cells in the epithelium around the artery. The exact mechanism linking COPD and arteriosclerosis is unknown, but systematic inflammation is suggested to be an important factor, occurring especially during COPD exacerbations following bacterial infections. This is a diagram that the authors developed to show the correlation between certain risk factors of COPD and then how the risk factors also lead to diseases of the liver, arteries, and heart. So as I mentioned earlier, cigarette smoke is a common factor for COPD. So it's that microorganisms, cigarette smoke, and environmental pollutants can lead to this pulmonary inflammation and oxidative stress, airway and intestinal colonization of those microorganisms, and dyslipidemia, which is the buildup of lipids within the lungs and then in the heart tissue. And then these three things can then lead to systematic inflammation and oxidative stress, which affect the liver, arteries, and heart. This specifically focusing on the arteries and heart, which causes the thickening of the arteries and then the heart having to pump harder to be able to supply the peripheral tissues with nutrients. So the overall purpose of this paper is to examine studies in which COPD and CVD both appear in patients or in murine models, which is mouse models, and to hopefully determine an optimal form of treatment for these patients. Currently, patients who present with COPD and CVD are treated for COPD with a complementary CVD treatment. This includes common COPD treatments are steroids and oxygen supplementation, whereas with the CVD complementary treatment, it's that they recommend a change in diet, surgery, or anticoagulant medication such as warfarin can be helpful in decreasing the closing of arteries because warfarin decreases the thickness of the blood, which allows the blood to flow through these narrowing arteries even sooner. And as you see in the top left corner, it's that quitting of cigarette smoke, that quitting of introducing that chemical to your lungs and to your body can definitely help decrease any lung infection or problems that may occur. So these are the types of mice and treatments that the authors were looking at. The first treatment was mice exposed to short-term cigarette smoke, and that was to trigger COPD. And the second was a buildup of lipids. The LDLs is low density LD, like cholesterol. And so, as you see, these mice did not develop emphysema, but they did develop systematic and pulmonary inflammation due to that short-term exposure to cigarette smoke. And because there was no emphysema present, that pulmonary and systematic inflammation probably wasn't as pronounced as in other cases, so the arteriosclerosis wasn't as pronounced either, which is why that's that yes-no, because it's that it wasn't present in all the mice. Then there was that long-term exposure to cigarette smoke, and the same treatment for the CVD, and so that emphysema was present, and arteriosclerosis was definitely present. It's that they could just see that correlation between emphysema being present and arteriosclerosis being present. So they tested a few other models for COPD and CVD to try and determine which were being more correlated between the pulmonary inflammation and then the inflammation of the arteries. And as you see, it's that where there's a strong emphysema correlation, there's also an arteriosclerosis correlation. Whereas when there is not as strong a emphysema correlation, the arteriosclerosis inflammation is also not as clear. And so for all types of COPD, types of pulmonary inflammation is seen, which is seen to be correlated with then the spread of systematic inflammation. And then this systemic inflammation is then what is thought to be the cause of this arterial buildup of white blood cells and other cholesterols. So, based on the results from the reviewed experiments, the authors came up with possible treatments for specific, to be specific to the symptoms and risk factors. So, for microorganisms and cigarette smoke to hopefully relieve some airway and intestinal colonization or the pulmonary inflammation and oxidative stress, they're curious to see if bronchodilators would help at all. But what they were seeing was that anti-inflammatory drugs inhibit the airway and intestinal colonization, as well as the pulmonary inflammation and oxidative stress at the COPD level, as well as the systemic inflammation and oxidative stress at the systemic inflammation level and cardiovascular disease. And then there are antioxidants and vitamin D, which can be used to inhibit both pulmonary inflammation and oxidative stress, as well as systemic inflammation. And same with lipid-lowering drugs, healthy lifestyle. So it's that what they're already seeing is confirmed that it's that there's this healthy lifestyle and healthy living environment that affects both the lungs and the heart. But find anything super conclusive because they weren't running any tests themselves. So my discussion questions are, why is cardiovascular disease the most important and common comorbidity of COPD? And then my second question is, from this review, what experiments can be designed to further test optimal therapies? Thank you so much. Have a wonderful rest of your day. Bye.